Is your dog suffering in silence, unmasking hidden pain signals? Hey everyone, welcome back to the channel. I'm so glad you're here because today we will be unmasking hidden pain signals that your dog may be suffering in silence and what you should do about it. It can be heartbreaking to think our beloved dogs might be suffering in silence. As devoted dog owners and pet lovers, we want to ensure their comfort and well-being. Since they can't verbally tell us when they're hurting, it's crucial to become adept at recognizing subtle signs of pain. This guide will help you become a pain detective, empowering you to provide the best possible care for your furry friend. Dogs often mask pain, making it essential to observe their behavior closely. Changes in their usual demeanor can be a significant indicator that something is amiss. Vocalization. An unusual increase in whimpering, yelping, groaning, or howling should raise a red flag. While some dogs are naturally more vocal, a sudden change suggests discomfort. It's important to differentiate between attention-seeking vocalizations and those stemming from pain. Social withdrawal. A dog who suddenly hides, avoids interaction, or becomes less engaged in family activities might be experiencing pain. This withdrawal is a protective mechanism as they seek solitude to cope with their discomfort. Don't dismiss this as simply being tired. Investigate further. Increased neediness. Conversely, some dogs become clingier when in pain, seeking more attention and affection than usual. This behavior is driven by a desire for comfort and reassurance. While it's heartwarming, it's also a signal that they need your help. Irritability or aggression. A normally friendly dog who starts snapping or growling when approached or touched, especially in specific areas, is likely in pain. This is a clear sign that they're trying to protect themselves from further discomfort. Never punish a dog for this behavior. Instead, seek veterinary attention immediately. Changes in daily life activities. Pacing or restlessness, with your dog seeming unable to find a comfortable position, can indicate underlying pain. They may be constantly shifting, trying to alleviate the discomfort. Observe their body language closely during these episodes. Changes in daily habits. A loss of appetite, changes in sleeping patterns, sleeping more or less, or accidents in the house can all be pain-related. Pain can disrupt normal bodily functions and routines. These changes warrant a thorough veterinary examination. Self-mutilation. Obsessively licking or chewing at a specific area of the body is a serious sign of pain or discomfort. This behavior can quickly lead to skin damage and infection. It's crucial to address the underlying cause of the pain to stop this destructive cycle. Changes in a dog's mobility are often easier to spot than behavioral changes, but they can still be subtle. Pay close attention to their posture and gait. Altered posture, holding an arched back, carrying their head low, or positioning their tail abnormally, can indicate pain in the spine, abdomen, or other areas. These postural changes are often an attempt to minimize discomfort. Stiffness or limping. Favoring one limb or exhibiting difficulty walking is a classic sign of pain. Even a slight limp should be investigated as it can indicate a sprain, strain, or more serious condition like arthritis. Trouble moving. Difficulty sitting, climbing stairs, getting up from a resting position, or jumping on furniture are all signs of mobility issues related to pain. These limitations can significantly impact a dog's quality of life. Reluctance to exercise. Slower walking or hesitation to engage in physical activities they once enjoyed is a common sign of pain. They may be avoiding activities that exacerbate their discomfort. Don't force them to participate. Instead, consult with your veterinarian. Beyond the obvious signs, there are other subtle indicators that your dog might be in pain. These often go unnoticed but can be crucial in early detection. Panting. Excessive panting even at rest, especially when it's not hot, can be a sign of pain. Pain can elevate heart rate and respiratory rate, leading to increased panting. Facial expression changes. Flattened ears, grimaces, or glazed eyes can all indicate pain. These subtle facial cues are often overlooked but can provide valuable insights into your dog's emotional state. Changes in activity level. Lethargy or unwillingness to move can be a sign of underlying pain. While some dogs are naturally less active, a sudden decrease in activity level should be investigated. If you notice any of these signs, it's important to consult with your veterinarian promptly. Early detection and intervention are crucial for effective pain management. Your veterinarian will conduct a thorough physical examination, and may recommend diagnostic tests, such as X-rays or blood work, to determine the cause of the pain. Based on the diagnosis, your veterinarian will develop a pain management plan tailored to your dog's specific needs. This plan may include medications, physical therapy, acupuncture, or other therapies. Remember, you are your dog's advocate. By being observant and proactive, you can help them live a more comfortable and fulfilling life. Your attentiveness and care are vital to your dog's well-being. Now that you're equipped with the knowledge to recognize hidden signs of pain, take the following steps. Become a pain detective. Observe your dog's behavior, mobility, and subtle cues daily. Document your observations. Keep a record of any changes you notice, including when they occur and what seems to trigger them. Schedule a veterinary checkup. If you suspect your dog is in pain, don't hesitate to consult with your veterinarian. Early intervention is key. Share this information. Help other dog owners by sharing this guide with your friends and family. Together, we can ensure that all dogs receive the care and attention they deserve.